Hello, my name is Anne Green and Nauman. I'm a physical therapist here at the University of Vermont Medical Center, and I work with total joint patients. I'm here today to talk to you about getting ready for your upcoming total joint surgery. This presentation is designed to help you prepare for your upcoming surgery. We hope it will inform you about what you can expect during your stay at the UVM Medical Center, including strategies that will help to make you more comfortable. The first thing I want to talk to you about is resources. Your total joint binder is your main resource for information about your upcoming surgery. It has pretty much everything you need to know in it. In particular, I want to point out to you that when you get home after your surgery, if you have a question or a problem, that you can reach us at any time. You can reach us because in the back of your book, if you flip to the very back, it says Staff Directory. I'm going to just show it to you. At the bottom of the page, there is a phone number for reaching us here at Tilley Drive. The number is 847-2663 or 847-BONE. If your surgeon is at San Remo Drive, the phone number is 847-7855. So remember that you can always get a hold of us if you should need us. So the things that we are going to talk about today are getting your body ready for surgery, getting your home ready for surgery, equipment that you will need, how long you'll be in the hospital, how do we know when you're ready to go home, the care that you'll receive at home, what to expect in terms of your physical therapy in the hospital, at home, and at your 1-month visit, post-op visit, your precautions, your exercises, and what you can expect about your recovery. So lots to cover. So, preparing your body. Before your surgery, you will have a nasal swab to assess for the presence of MRSA bacteria in your body. If MRSA is found through the nasal swab, you will need to shower for 5 consecutive days before your surgery with a special soap that we will provide you. You will also be given a prescription for a nasal ointment to decrease the bacteria in your nose before surgery. This is designed to prevent infection of your new joint. In addition to that, the night before your surgery, you will shower, and in the morning of your surgery, you will shower with an antibacterial soap that we will provide for you. You should wash your body with this soap from the neck down. You can use your usual shampoo and face wash. After your nighttime shower, please put on some clean sleepwear. You should not eat any solid food after midnight the night before your surgery. You may drink water after midnight. In addition to that, we ask that you drink and finish 12 ounces of a sports drink such as Gatorade or Powerade 2 hours before you arrive at the hospital for your surgery. One of the things patients ask us is what to bring to the hospital. So you should bring underwear and loose-fitting clothing such as shorts, t-shirts, sweatpants, pajamas, or a short bathrobe, and non-slip slippers. In addition, we have non-skid socks if you forget your slippers. If you would like to wear hospital pajamas, you can do that. You should bring your eyeglasses, hearing aids if you have them, and any necessary personal toiletries. Any braces or orthotics that you normally use, a walker or crutches if you plan to use them after your surgery. Leave them in your car and you will have them on the day you go home. Next, we're going to talk about preparing your home for safety. You should plan for somebody to be with you at home after your surgery for up to a week, especially at night. You are not going to feel like standing to make a big meal, so you need to think about how you're going to feed yourself. That might mean preparing extra meals and putting them in the freezer. It might mean stocking up on frozen foods. It might mean having your friends bring you food. Whatever your plan is, you have to eat to heal. You will need to plan to have somebody to take care of your pets when you're in the hospital and when you first get home. You will not be walking your dog. You will also need help with clearing the snow and doing any yard or housework, because you will not be doing that right after your surgery. Okay, think about placing items that you use on a regular basis at arm level or so that you don't need to squat down or reach up. This is particularly important for our total knee patients. Think about setting up a recovery center so that you can rest downstairs during the day if you need to. This might be on your couch, and we ask that you do things like get your Kleenex and your clicker for your TV and your portable phone and your water bottle and your reachers and your grabbers and anything you might need during the day. That's going to save you some walking. One of the things that happens at home after surgery is people trip on things. So we would like you to think about taping down any electrical cords that you might have where you might be walking. So some duct tape or some clear tape to tape that down. In addition, we would like you to plan to turn on the light or have some night lights along the course of the bathroom. And you may think, I've been to the bathroom a million times in the dark. I don't need that. But falling down is a big deal, so we ask you to take this precaution for your safety. Remove any throw or area rugs that could cause you to slip or trip. The next thing we're going to talk about is equipment. The first piece of equipment we're going to talk about is walking devices. All patients who have had total joint surgery usually begin by using a walker or crutches. You may graduate from a walker to a cane once a smooth, pain-free gait pattern has been reestablished. Typically that's 2 to 4 weeks after your surgery. Getting a walker that has wheels makes it a lot easier. It means that you don't have to pick the walker up and put it down, and that helps to save some energy and not make you as tired. Again, you want to bring your walker or crutches to the hospital with you, but leave them in your car on the day of surgery. When you think about getting a walking device, you're going to want to fit it. When fitting a walker or cane, the walker or cane handle should come to your wrist level or the level of your watch with your arm hanging at your side. Crutches should have a 3-finger width space between the top of the crutch and the armpit when you're standing up straight, and the handle should be adjusted so there's a slight bend in your elbow. Patients who are having their knees replaced or having particularly 2 knees replaced may want to think about a tub bench or shower chair. This means that you can sit down in the shower, which you will find helpful. Everyone is going to want to have some handrails or grab bars for the shower or tub. We like the kind that you screw into the wall because those are the most stable. But if there's some reason that you can't screw into the wall, you can get some suction cups that are quite good. You're going to want to test them every single time that you use them before you get in the shower so that you don't end up naked on the floor with the handle in your hand. In your book, you will find on page 11, on page 10, a list of some places that you can think about getting equipment. And then on page 9, the list of this equipment, okay? Those of you who are having your knee replaced may find that a hip or a knee kit will be helpful to you. This includes a long-handled sponge so you can wash your feet, a reacher so that you don't have to bend over to pick things up, a long-handled shoe horn in order to make it easier to get your shoes on, and a sock aid or sock donner that helps you get your socks on. If you are not having your knee replaced, or if you have somebody at home who can help you with these things, you don't need to purchase these, but you may find it helpful if you live alone. Other things that you may find helpful: furniture risers mean that you don't have to sit as low in a chair, so if you've had your knee replaced, or if you are having a posterior hip and there are special precautions around sitting too low, it raises your chair for you. Other things that you may find helpful are elastic shoelaces. This will turn any tie shoe into a slip-on shoe. You can buy these on Amazon, and you can also get them at any of the local medical supply stores. Last but not least, if you're going to use a walker, some kind of a basket or a bag to carry things is helpful. The next thing we're going to talk about is your pre-op phone call. Someone from the preoperative department will call in the 2 weeks before your surgery. You will receive a letter telling you the time of that call. please be prepared for this call with a list of all the medications you normally take. This will allow us to have those medications available if you should need to stay overnight in the hospital. Please also be prepared with a list of your questions, such questions as anesthesia questions, concerns about your hospital stay, that kind of thing. So be ready so that you can get all your questions answered. Next, we are going to talk about precautions with having total joint surgery. So for all types of joints, both hips and knee replacements, we ask that you have all of your necessary dental work performed more than 1 month before your surgery. Please hold off on dental work for 6 months after surgery as well. If you have an emergency, it's okay to go get things taken care of. We just want you to avoid elective things. Once you do go back to the dentist, you will need to take an antibiotic anytime you have a dental procedure, including cleanings, for 2 years after surgery. We will provide you with a prescription for those antibiotics. You will be given a waterproof dressing and will be able to shower 2 days after your surgery. So you can get in the shower and let the water run over the dressing and then pat it dry after showering. We do not want you to submerge yourself in water. So no bathtubs, no hot tubs, no swimming pools until your incision is completely healed, no scabbing or any other opening. This can take up to 4 weeks after surgery. When you do get up to walk after your surgery, you may put as much weight on your operated leg as you feel comfortable with. We ask that you don't pivot aggressively on your operated leg. Patients who have a total knee replacement will have a large bandage which typically stays in place for 1 week. There will also be a glue mesh under the bandage that can be peeled off approximately 3 weeks after your surgery. Total hip replacement patients have special precautions in order to prevent your new hip from dislocating. Your surgeon will determine your precautions based on the surgical approach used and their assessment of the tissues during surgery. Patients who have an anterior approach, typically normal motion is allowed, and we ask that you avoid extremes of motions. This means that we don't want you doing yoga poses or swinging golf clubs, which would also combine 2 motions together. So normal motion is allowed, avoid extremes of motion, and avoid combining 2 different motions together. For patients who are having a posterior lateral approach, we ask that you do not bend your hip higher than a 90-degree angle. You have to consider this when you're getting up and down from chairs, when you're putting your pants on or putting on your socks. We ask that you don't cross your leg past the midline. And we ask that you don't turn your leg inward. And the reason is that the combination of bending, crossing, and turning inward, in theory, can cause your new hip to dislocate. In order to prevent that, we have you avoid each one of those. When you are in the hospital, we will manage your pain. Total knee patients will have a nerve block put in by anesthesia, which will make your leg numb. You will also have a local anesthetic injected around the joint during surgery, and then you will have oral medications that you take for pain. These will be the same medicines that you will go home with. When we think about pain management in the hospital, we want your pain to be under good control. What this means is that we want you to be able to sleep, do your exercises, and do your physical therapy. We want your pain to be manageable, but we do not expect you to be pain-free. When you have a major surgery, there will be some pain associated with it. We also don't want you to overuse narcotic pain medications. The types of medicines that you will be taking in the hospital and at home include Tylenol, a non-steroidal anti-inflammatory drug, for example, meloxicam, ibuprofen, Aleve, or Celebrex. You will be taking some opioid pain medications, including tramadol, oxycodone, to be taken as needed for pain. You will also be taking a blood thinner, You may be taking an antacid, such as Protonics. Less commonly, you might also be taking a muscle relaxant, such as methylcarbamol or Robaxin, or an anti-nausea drug, such as Zofran. When you are home after your surgery, you will be taking these medicines. Please remember to give us 24 to 48 hours notice to refill your medications. Please do not wait until you are all out of medications to call us. If this happens, it's possible that we won't be able to get to them to you before our pharmacy closes, so please plan ahead. Next, we're going to talk about when you might go home. Your surgeon may discuss the possibility of being discharged on the same day as your surgery. This decision is based on several factors, some of which are your overall health, the amount of assistance you will have at home, and how far you live from the hospital. After your surgery, staff in the hospital will begin to make arrangements for your discharge from the hospital. There are 3 possible discharge options. Most of our patients go home with home health care, which usually includes physical therapy. You should prepare to have somebody with you at night for up to 1 week after your surgery. The second option is acute rehabilitation at UVM Medical Center. This usually is for patients who are having 2 joints done at the same time, or patients who have very complex medical needs. The last choice is subacute rehab at an area nursing facility. Again, most of the time our patients go home to their own homes. You will be cleared to go home when you're medically stable, when you're able to walk safely with your walker or crutches on level surfaces with the assist of the person who will be at home with you. You are safe getting in and out of bed on your own or with the help of the person who will be at home with you. You are able to use the toilet safely with the assist of the person who will be at home with you. You are able to void or urinate. And then your pain is controlled well by oral medications. When you get home, you will spend most of your time the first few days lying on the couch or bed with your leg elevated above your heart. Make sure you place pillows so that all of your lower leg is elevated, which will keep your knees straight. So sometimes people are confused by this. When you have a total hip replacement, we aren't asking you to elevate your hip. We're asking you to elevate your leg above your heart. This prevents swelling and blood clots. It is important to take your medications as prescribed in order to stay ahead of your pain. We don't want you to wait until you have your pain to take medication, because then you're going to be rather unhappy. You should get up and take a short walk at least every 2 hours. This is for circulation and to prevent swelling. You may need assistance in lifting your leg to get in and out of bed at first. You may need assistance in dressing, putting on your shoes and socks, meal prep, house cleaning. You should do all of your exercises twice a day. It is also important for you to move your leg to keep it from getting stiff, to prevent blood clots, and to help with swelling. If you have had a total knee replacement, you should bend and straighten your knee every hour that you are awake. This is how you get your range of motion back. The faster you get your knee to bend and straighten, the easier it is. You can expect your leg to be swollen. Manage your swelling by elevating your leg above your heart. Place pillows so that all of your lower leg is elevated. This will keep your knee straight. We don't want you to put a bunch of pillows under only your knee, because then that bends your knee and it will prevent you from being able to straighten it all the way. Be sure to wear compression stockings. Again, to manage your swelling, we want you to keep your leg elevated, and then there are some exercises that you can do that will help with that. We'll go over these in a few minutes, but they include ankle pumps, quad sets, and cheek squeezes to improve blood flow. You should get up and walk around at least every 2 hours. You should apply ice to the operated joint. Those of you who are having your knee replaced will have a cryo cuff after your total knee replacement. This is an awesome device that has a Velcro sleeve that goes around your knee and comes with an ice bucket that will circulate cold water around your knee. They are great and they are your friend, and you should use them. If you have any trouble with your cryo cuff, you can call 1-888-405-3251. This information will be in your book also. As you are home and healing begins, you will feel more comfortable being up on your feet. When your leg starts to ache, that's a signal that it's time to lie down and elevate your leg again. So you'll start out when you first get home and you'll only be up maybe for 15 or 20 minutes before your leg starts to ache. As time goes on and healing happens, it might be 30 minutes and then an hour before you start to feel it. You're going to listen to what your joint tells you. You will gradually increase the time you are up based on your tolerance. You can take short walks. Start in the house and progress to outdoors as tolerated. Start with 10 minutes of walking 2 times a day. You will be clear to drive when you are no longer taking any narcotic pain medications, when you can walk with your walking device without limping, and when you feel ready. Next, we're going to talk about physical therapy after your surgery. If you are discharged on the same day as your surgery, a physical therapist or PT will see you in the post-op area. They will make sure that you are safe with your walking device, that you can get in and out of bed and can use the bathroom independently or with the assist of the person who will be home with you. Please do not try to get up by yourself. If you will be staying overnight in the hospital, nursing staff will help you to get out of bed on the day of your surgery. If for some reason you have not gotten out of bed, feel free to ring your call bell and ask to get out of bed. A physical therapist will come to see you the day after your surgery. They will assist you in getting out of bed, begin your exercises with you, and have you walk with your walker or crutches. Again, please do not try to get out of bed by yourself. It's a great way to fall down on the floor and injure your new joint. Please don't do that. When you are home after your surgery, remember, your most important job is healing. This is not a time to get big projects done. It's a time to rest, conserve your energy, elevate your leg, get up and move around frequently, avoid twisting on your operated leg, and manage your pain so that you're able to perform your exercises. The home health agency will contact you within a day after your discharge from the hospital to plan for your home visit, which is a physical therapist. When the PT visits, they will check your blood pressure, they will look at your incision, they will draw blood if you're on blood thinners. They will also inquire about how you're doing with your pain and help you work on pain management. PT will continue to work on mobility, range of motion, and will progress the exercises you started in the hospital.
So the first exercise is an ankle pump. The ankle pump exercise is one where you pull your foot all the way back, hold it a second, and then point it way down. Typically we have you do about 10 repetitions at a time. The idea of this exercise is to help keep blood moving through the calf, because when blood stays still it tends to clot. It's something we wouldn't want to happen. The other thing the ankle pump action does is it helps to move fluid back into circulation. So after your surgery your leg is normally quite swollen, and this will help with the swelling. The next group of exercises that we're going to focus on are what I call the squeezing exercises. These are isometric contractions of the different muscles in the leg. These help with swelling. They help to keep blood moving through the leg. They're going to also help you from getting weak quite so fast as you might otherwise. So the first one is called a glute set, and what you're going to do is put your hands on the sides of your cheeks, and then you're going to squeeze your cheeks together, hold, and then relax. And while you're doing that, you're going to try not to hold your breath. So again, you're going to squeeze your cheeks together, hold and breathe, and relax. And typically we have people do repetitions of 10 at a time. Okay, the next exercise that we're going to do is a squeezing exercise for the muscle in the front of the thigh. So this is an isometric contraction of the quad. What you're going to do is think about pushing your knee backwards and tighten the muscle on the front, hold, and then relax. Try again, push your knee backwards, tightening that muscle, hold, and then relax. Great job. This exercise again, we're going to do 2 or 3 sets of 10 several times a day. You're going to remember to keep breathing as you do it. This exercise is going to help with swelling and keeping the blood moving throughout the leg. The next exercise, another squeezing exercise that's going to help with swelling and keeping the blood moving through the thigh. What you're going to do is sit, have your knees slightly bent. You're going to push your heel into the floor or bed, and that's going to tighten this muscle in the back of the thigh. Hold, and then relax. So push the heel into the floor, tighten this muscle right here, hold and relax, remembering to keep breathing. Okay, the next exercise that we're going to do is a heel slide. Typically this exercise is done lying in bed, and you basically bend your knee up, bringing your heel up towards your bottom, hold, and then lower. Those of you who are having a hip replacement will be sure to not allow your hip to bend more than 90 degrees in this position. Those of you who are having a knee replacement, this is one of the ways that you can work on bending your knee. So you might want to hold that a good 10 or 20 seconds on the way up, hold it all the way bent, and then let it down again. The next exercise is one where we're going to begin to work the quad muscle at the front of the thigh through some of the range of motion that you'll have. So you're going to be lying in the bed with a little bit of a roll under your knee. This can be a rolled up pillow or a rolled up blanket. And then from here you're going to kick the leg all the way up straight, hold, and then lower it down until the heel comes in contact with the bed again. And again, up, hold, and lower it down. Great job. So in order to do the same exercise sitting in the chair, you would sit up on the edge of the chair so your knee was slightly bent, your heel was resting on the floor. From here, you would straighten the knee up, hold, and then lower down. So you're working through motion of about 30 degrees. So again, slightly bent in the knee, straightening the leg all the way up, holding, and then letting the leg come down. Okay, the next exercise is one that is for your hip flexibility. You'll do this one lying in the bed with the legs straight out in front of you. And what you're going to do is slide your leg out to the side, keeping the kneecap pointed up to the ceiling, hold it out to the side, and then bring it in. So sliding the leg out, holding, and then sliding it in. This is especially important for those of you who are having your hip replaced, because this is a direction your hip has not moved in a while, and you'll now have the ability to move it further, and we want to get the muscles and tendons to be able to do that. The next exercise is one where we're going to work the quad muscle at the front of the thigh through more of the range of motion. This is a little bit harder than the one where we worked it only through part of the motion. So for this exercise, you will be either sitting in a chair or sitting on the edge of the bed with your knees bent to a 90-degree angle. From there, what you're going to do is lift your foot up off the floor, straightening your knee all the way, holding, and then slowly lowering down. So kicking the leg all the way up straight, holding, and then lowering it down. One more time, leg all the way up straight, holding and lowering down. Typically we do most of these exercises in repetitions of 10 to start. You can do 2 or 3 sets of 10 a couple of times a day for most of these exercises. The next group of exercises that we're going to be showing you are exercises that will be done in a standing position. When you do these exercises, you're going to want to hold on to either your walker, the back of a chair, or a kitchen counter in order to be safe. The first exercise, you're going to be standing up tall, and you're going to lift one heel up towards your bottom, hold, and then lower down. You're going to repeat this 10 times, and we're going to have you do this on each leg, the affected leg that you have surgery on and the other leg. The next exercise that we're going to do standing is a marching exercise. We still would like you to hold on for safety. You're going to hold on to the side of the chair, bring one knee up towards your chest, stopping when you get to a 90-degree angle at your hip. Hold, and then lower. Then you'll switch to the other leg, bringing the knee up towards your chest, stopping at a 90-degree angle, and then lowering down. Stopping at a 90-degree angle is especially important for those of you who are having a hip replacement. Next standing exercise we're going to do is a standing hip extension exercise. This is both going to work your rear muscles and help you to gain your hip motion into extension. So you're going to, again, stand holding onto the counter or a chair or your walker, keeping your trunk up straight, kicking one leg back behind you as far as you can, hold, then lower, and then switch to the other leg. And back and forth. The next standing exercise that we're going to do is one where you lift your leg out to the side against gravity. This is a progression of the exercise that we did lying in the bed, lifting the leg out to the side. What you'll do is again stand up holding onto the chair, a counter, or your walker. You'll lift the leg out to the side, hold, then lower it down, and then switch legs, lifting the other leg out to the side, hold, and then lower down. The next 3 exercises that we're going to do are particularly focused for those of you who are having your knee replaced. The first one is a way to work on your bending motion. This exercise is particularly important because it's important to get your knee bending as quickly as possible. So what you're going to do is sit in a chair. You're going to bend your knee back as far as you can. You can use the other leg to give it a little bit of a push. Then you're going to hold it 10 to 20 seconds, breathing as you do this and letting it out again. It won't be particularly comfortable when you do this exercise. The rule of thumb is that if it's uncomfortable while you're doing it, but that when you let the pressure off the knee, the discomfort goes away, that's just fine. If it's uncomfortable while you're doing it and it aches for an hour after, you've pushed too hard. Typically, we want you to do this exercise several times every hour. This next exercise, again, is going to be focused for those of you who are having your knee replaced. What you're going to do is be lying down. You're going to bend the non-operative leg up so your foot is flat on the bed. On the operative side, your knee is going to be all the way straight. You're going to pull your foot back, tighten the muscle in the front of your thigh, and lift your leg until it's even with the other knee. Hold, and then slowly lower down. Typically, we have people do repetitions of 10 of those at a time. This next exercise is focused for those of you who have had your knee replaced. It's a way to work on getting the extension motion back in your knee or the straightening motion. What you're going to do is have your leg all the way straight out in front of you. Rest your heel up on a little bit of a roll, a towel roll, or a pillow roll. Your knee will be slightly bent. What you're going to do is allow gravity to help you to straighten the knee as far as you can. Hold it, good 10-20 seconds, and then you can relax it again. Again, this is an exercise that we'd like you to do frequently, several times every hour. Same rules apply in terms of it should be somewhat uncomfortable while you're actually doing the stretch, but when you let the pressure off, the discomfort should go away fairly quickly.
Now we're going to talk about pain management at home. Again, you will go home with the medications you've been taking in the hospital. Only take the narcotic pain medication as needed and no more than prescribed. Follow your pain medication schedule for the first 2 weeks. After 2 weeks, you want to begin to gradually taper off the pain medication, starting with the narcotics, and then start to taper off the tramadol as tolerated. Nursing staff in your surgeon's office are available to help you with this. Remember that the phone numbers are in your book. Total joint surgery is wonderful surgery and it goes very well, but there are a couple of things we are concerned about. These include infection and blood clots. Signs and symptoms of concern include a fever, which we define as a temperature of 100 or more, drainage from your incision, redness around your incision, increased swelling, or calf pain. If you have any of these symptoms, please call your surgeon's office or your home health agency. Or if you have any other unusual symptoms, please feel free to call us. Call 911 if you have trouble breathing, chest pain, or signs of a stroke, drooping face, difficulty talking, weakness in one arm or leg. It is not likely to happen, just in case we have to tell you. At 4 weeks after your surgery, you will come to visit us in Orthopedics. You will have a follow-up visit with your surgeon. They will review your x-rays, check your range of motion, check your walking, ask about your pain management, and discuss ways to keep your new joint healthy. You will have a physical therapy appointment on the same day as your post-op surgical appointment at 4 weeks. We would love to have you come and do your physical therapy with us here. We work with a lot of total joint patients and we're very good at total joint rehab. But we understand that you may already have a physical therapist that you're working with and you may choose to go see them after you have your post-op visit. In order to see us at the 4-week visit, you have to not still be receiving home health services. You should also be aware that some insurances require prior authorization for therapy services, and your physical therapy visit may have a separate copay from your surgical visit. If you are receiving physical therapy elsewhere, your surgeon will give you a copy of the protocol and exercises and contact information. You should make an appointment with your PT for the week after your follow-up with your surgeon. You will then have follow-up visits with your surgeon at 1 month, 4 months, 1 year, and then every 5 years after that going forward. Please remember, if you have questions or concerns at the end of this video, that you can access us through the phone numbers that are in your book. We hope this presentation has been helpful. It is meant as a preview of what your hospital stay may entail. The staff will review the process with you each step of the way and will answer all your questions as you go along. The thought I want to leave you with is life is good with a new joint. You will be very happy with your new joint. If you have any further questions about physical therapy, you may call us here at Tilly Drive at 802-847-7910. In addition, any questions about walking devices, equipment, exercises, or precautions, we're happy to answer.